Dementia Researcher with a blog and a rating.
There's a new INTERDEM task force in town looking at inequalities in dementia care. In October, we were finally able to attend the Alzheimer's Europe conference in person again. Fair to say, restrictions easing and the ability to meet one another in person, in the flesh again, after such a long time was exciting, and made up half of the time of attending the conference, catching up over continuously flowing tea and deliciously served food. Attached to each annual Alzheimer's Europe conference is the annual INTERDEM meeting, where members and task force leads present on the annual progress and new evidence. It is also a great way to reconnect and catch up with fellow European researchers in the field, in a purposefully planned meeting environment, on a scale that's smaller than the actual conference. For those of you who are not yet familiar with INTERDEM, it's a European network of dementia researchers focusing on early detection and timely intervention in dementia. Task forces are a way of strategically bringing together researchers on different topic areas and conduct research and apply for funding together. There are task forces on, for example, social health and environment and architecture. This year, I introduced a new task force looking at inequalities in dementia care. Over the past few years, my research into the topic of inequalities has expanded from national to global research, including working with Colombia, India, Netherlands, and Australia. That's why having the established platform of INTERDEM to bring together European researchers in the field seemed like a really good idea to try and all work together on addressing the myriad of system, community, and individual level barriers that exist for people when trying to access and use dementia care. With my colleague Dr. Carrie Hanna as deputy, and together with the Alzheimer's Society and the European Working Group of People Living with Dementia, as well as 6 countries represented already, our first activities will include a position paper on inequalities in dementia care across Europe, as well as a review into inequalities and joint grant applications to address different levels of inequalities together. Whilst there's growing levels of research on individual types of barriers to accessing care, such as financial and educational background, ethnicity, or neighbourhood deprivation, very little research has focused on the intersectionality of different generic and dementia-specific barriers. Even less so, there are very little to no European comparisons. So hopefully, this task force will help to address this gap in the evidence base, whilst also providing a crucial platform to connect across country borders, regardless of Brexit or not, showcasing the strength there is in international collaborations. Of note, if you are an INTERDEM member and working on the subject area, please drop me an email.
Thank you for listening. Join the Dementia Research bloggers and share your own views.